Hello viewers, welcome once again to my YouTube channel, and in succession to the videos what I have been taking up in psychology, today's video of the discussion I'll be mainly focusing upon one of the very important theories of child psychology, which is being very frequently asked in wheresoever the psychology questions are being put up. It is about the classical conditioning theory. So this classical conditioning theory, which was proposed by Ian Pavlov, and he was a Russian psychologist, and he gave this classical conditioning theory based on his experiments with the dog. So the classical conditioning theory is experimentally based on the Pavlov's dogs theory, dogs experiments, and in this theory he has said that the learning process, what is there, it is always it is in association of one stimulus to the another. So this classical conditioning theory, it tells us that one stimulus is going to act as the learning process what is there in any individual. It is just by an interaction of one stimulus with the another stimulus, and therefore sometimes this classical conditioning theory, it is also being referred to as learning by association. So what do we see in this classical conditioning theory? The most importantly, it is being very importantly asked as a dental implications of it for the dental graduates. So when writing about the dental implications, we need to understand the basic principles involved in it. So the four basic principles what are associated with this classical conditioning theory is, that is about the first principle, what they say is simple, it is called as the acquisition principle. So the first principle what is there, it is the principle of acquisition. And since what is acquisition, so when we see at acquisition, any stimulus what we learn from an environment, any response what we learn from an environment, it is an acquisition. Similarly, whenever the child visits to a dental clinic, whatever the child is learning in the day-to-day experiences, that is a general concept, that is the general principle of acquisition. Whatever learning what we are seeing in the environment, whatever things the child is observing around himself, that is everything he is acquiring. And first principle of classical conditioning, it is the acquisition. Now moving on to the next important principle, the next principle of classical conditioning is generalization, wherein the process of conditioning is evoked by a band of stimuli centered around the specific conditioned stimulus. So similarly, whenever in general terms, when understanding about the dental implications of it, what do we see? That whenever a child pediatric patient, whenever he is going to enter a doctor's clinic, a pediatrician's clinic, whenever he is going to visit, he is going to find that pediatrician in a white coat. So this is acquisition of the child, that once he is entering into the hospital, whatever doctor he is finding, they are all dressed in white coat. So this is the principle, this is the acquisition, this is the basic learning what the child is acquiring just by observing a person with a white coat. The little child will assume that he or she is a doctor. Now similarly on generalization, when it comes to generalization, so this acquisition was already there in the child. Now when we look at the generalization, so a similar stimulus in the similar response, the similar situation, the child has to understand in the very same manner. So wheresoever the child, either it be outside, either it be anywhere else, wheresoever if the child is going to find that a person wearing a white coat, he will assume it to be a doctor. For example, what is generalization? And supposing when the child's visit was there in the dental clinic or in the normal clinics, and that pediatrician or the pediatric dentist is treating that child patient, and certain shots are being given to the child, so the child has acquired that a person who is going to wear a white coat is going to evoke pain. So This is the basic acquisition what the child has related to. So the white coat is the stimulus, and the shot, the needle injection by the pediatrician or the shots given by the pediatrician or the pediatric dentist, it's the generalization what the child has been associated to it through learning. So a child who had a painful experience with a doctor in the past with wearing a white coat, always he's going to associate any doctor in a white coat with pain. Now these are the two principles. First was the acquisition, next is the generalization. Firstly, the child acquired the knowledge, then he is generalizing that knowledge on any person who's wearing a white coat. Now moving on to the third principle, that is extinction. So extinction, it is always said that the removal of the conditioned behavior results if the association between the conditioned and the unconditioned response is not reinforced. For example, if the third visit, if to a different dental setup, if to a different dental clinic the child is visiting, and supposing a different doctor has come, he or she is not going to evoke pain and the child is not having any unpleasant experiences in the new dental clinic, so the extinction of the fear what the child has acquired will fade away. So the third principle what is there in the classical conditioning, it is the extinction. So if anywhere there is a misassociation or there is an improper if the condition, if the between the behavior, the conditioned behavior and the unconditioned response what the child is showing, if there is some kind of a misassociation between the two, so that is ultimately going to be extinct. So whenever subsequent visits, if the child is not finding any pain, so slowly and gradually the child will learn that simply a doctor who is wearing a white coat, and if he is not causing, if there is not any unpleasant experiences, so slowly and gradually that will lead to the extinction of the fear. Now the next principle is discrimination. So slowly and gradually, as the learning process is there, once the child becomes accustomed to the dental clinics or the normal clinics, so wheresoever the child, whatever the acquired knowledge was there, whatever acquisition was there, whatever generalization was there, slowly and gradually the extinction of the fear is also there if the child is not going having any unpleasant experiences in the subsequent visits. So what is discrimination? It is opposite to that of generalization. Just in a very similar, initially the child has generalized any individual who is wearing a white coat is going to evoke pain. So after a certain time in subsequent visits, when the child is slowly and gradually understanding that so and so the every white coat wearing every doctor wearing a white coat is not going to evoke pain, is not causing pain, so slowly and gradually the child learns to discriminate, the child learns to differentiate that every individual who is wearing a white coat is certainly not going to evoke pain. So if the child is exposed to the clinic settings which are different to those associated with the painful experiences, the child learns to discriminate between the two clinics, and even the generalized response to any office, any dental office will be extinguished. So these were the very important, this was a very important, most important, the dental implications when students are asked to write in the dental surgery exams. So mostly they'll ask you about the principles of classical conditioning and the dental implications of it. So in this video I have talked about the dental implications of the classical conditioning theory, and this classical conditioning theory is very important since it is the theory what is also referred to as the learning by association. So the principles of classical conditionings, they can be used in the following areas of human and animal behavior. They are very important, the principles of classical conditioning, since it is learning by association. So these principles have been widely used in the development of good habits in the child, slowly and gradually breaking the habits and elimination of the conditioned fear. Slowly and with the help of classical conditioning, the child can be made to decondition the emotional fear, developing the positive attitudes can be there, and apart from this, with the help of classical conditioning, it can also be used in the inculcation or development of good habits and in teaching alphabets as well. So students and viewers, this was a very short discussion where I have tried my level best to simplify about the classical conditioning theory which was given by Jan Pavlov and the dental implications of it. So still you have any queries or comments, you are most welcome to comment me in the comment section. And viewers who are new to my channel and who haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.